Vibegron is a new beta-3 adrenoceptor agonist that was approved for the treatment of overactive bladder in Japan in 2018. We examined bladder function and the fibrotic and ischemic changes in the bladders of SCI mice with or without vibegron treatment. The spinal cord was cut at the level of TH829. We divided mice into 3 groups. Vibegron was orally administered at 30 mg per kilogram per day from 2 to 4 weeks after spinal cord transection. We did cystometry, real-time PCR of bladder tissues, and collagen and elastin assay of bladder 4 weeks after spinal cord transection. Here is the result. In the single cystometry, the number of non-voiding contractions per voiding was significantly smaller in the SCI with vibegron group than in the SCI with vehicle group. And then the time to first non-voiding contraction was significantly longer in the SCI with vibegron group than in the SCI with vehicle group. In molecular study, we observed marked increases in messenger RNA expression of we observed marked increases in messenger RNA expression of type 1 collagen, type 3 collagen, TGF-beta1, FGF, HIF-alpha, and VEGF at 4 weeks in the group B compared to the group A. And the increased expression of type 1 collagen, type 3 collagen, TGF-beta1, and HIF-alpha was significantly reduced in the group C compared to the group B. Here is the collagen and elastin assay. Total collagen and total elastin was significantly increased in the group B than in the group A. Although there is no significant difference in total collagen and total elastin between group B and C. Our results indicate that vibegron is useful for the treatment of neurogenic detrusor overactivity dependent on the activation of C-fiber bladder afferent pathways. Additionally, vibegron treatment improved bladder remodeling associated with tissue fibrosis as shown by the reduced messenger RNA expression of type 1 collagen, type 3 collagen, TGF-beta1, and HIF-alpha after vibegron administration. Although the protein level of collagen is not decreased yet at this stage of SCI. Vibegron treatment could be effective for reducing SCI-related neurogenic detrusor overactivity and remodeling in the bladder. Thank you for your attention.
Any questions from the floor? I actually do have a question.
Yeah.
You observed a disconnect between RNA and protein levels of collagen.
Yeah.
One went down and one did not.
Yes.
And you propose that this has to do with 2 weeks of treatment was not long enough. What do you think is long enough to observe a decrease in collagen? Because I'm aware of other examples in the bladder. For example, if you induce type 1 diabetes, collagen protein levels go down within a week.
Yeah.
So why do you think it's 2 weeks was not long enough? And discard the alternative, protein doesn't change.
Yes. We used 4 weeks after SCI mouse. So this is the early stage of SCI model. So I think if I give the longer time, over 4 weeks or 8 weeks,
okay.
I probably will find the changing of protein level of collagen.
Okay. Of course, only a real longer-term study will show that. I must say I'm skeptical.
Yeah.
Because other research has shown, and I'm not talking about one, but of multiple studies, that collagen decrease can happen within 1 or 2 weeks easily.
Oh.
So I personally feel, I don't know, I haven't done the study, you have done the study. Yeah. that it's more likely that RNA may not be reflecting of protein.
I'm now Kirishimura and both of this. Actually, this is a rat study, my study for 4 weeks. We have another drug, tadalafil, or other alpha blockers in 12 weeks, a rat model of SCI. Actually, those models up to 12 weeks, actually, collagen levels, protein levels decrease. So it's kind of this connection between the messenger level and the protein level in this kind of chronic model. So you're talking about DM model. We haven't done yet, but probably this model is a kind of slow protein synthesis is involved. And then some disconnection between the early phase messenger RNA levels reductions, and later we saw that the protein levels is decreased in the SCI rat model after the treatment alpha blockers or tadalafil PD5 inhibitors. So may take some disconnection between this model. Yes.
Okay, thank you. Any other question?
Yeah, well, you state very explicit that the effect of vibegron is on C fibers. I know that there is a change from, well, the importance of the C fibers increase in spinal cord injury. But how do you exclude that alpha A delta fibers are not involved?
Can you answer? So actually, probably we have that next presentation answer some questions about that. But so this is probably an indirect effect on. This is probably this vibegron beta 3 agonist reduce the spontaneous activity of bladder muscle to reduce the stimulation of A delta or C fiber. This case, C fiber is upregulated, so more likely to have that effect onto the C fibers. But next presentation, I guess that the more effect onto the A delta fiber function. Yeah, well, so it's depending on the situation of which A fiber, C fibers are kind of activated.
Yeah.
So,
because you have a motor effect, and motor effects and extension, that's A delta.
Yeah, that's what a normal condition. But in this case, C fiber is more dominant case.
I agree.
Yeah.
Okay. Thank you very much.